episode of Coding with Kate, we are going to be talking about the respiratory system. I think it's a great jump from our previous video where we talked about the heart and the cardiovascular system, specifically with the SA and AV nodes. Since we know how the heart creates and maintains its rhythm for pumping blood through the heart and then throughout the body, another component of that is the respiratory system, specifically with oxygen and CO2, carbon dioxide, and how breathing affects the blood and its circulation through the body. And I think going over the respiratory system is amazing because, yes, I knew that we have our lungs to breathe, but I didn't realize how much it impacts our blood and how some of the responses we have to those levels in the blood affect the way we breathe or when. It's really interesting. So today we're going to talk about some of that, and I'll go over a little bit of the anatomy, and then I'll jump over into some of the aspects of how we breathe, but I'm going to focus more on oxygen, CO2, and what that all means as far as our breathing and our overall body functioning goes, because I find it absolutely fascinating. Okay, so as far as anatomy goes with the lungs, we're not going to talk about the overall larger parts of the lung. We're going to focus on the deeper parts of the lung, and when you look very close inside the lung, you will see that the trachea turns into the bronchioles, which is at the very end. So this is our bronchiole, and then it branches off into the terminal bronchioles, which have our alveolar sacs, which are super cute. So these guys are the alveolar sacs. Now these, they look like bunches of grapes right off the vine, so you can think of them like that. They have these little beads or alveoli. So each individual one is an alveoli. And within the alveoli, there are different types of cells. And this is very cool. So within the alveoli, it's made up of 3 different types of cells. There are squamous cells. These are the type 1 alveoli cells, and they are what create the structure of the alveoli. So they are the ones that create this bulbous kind of shape. Then we have the great alveolar cell, or type 2, and these guys are for pulmonary surfactant. They create this pulmonary surfactant, which is essentially like, I don't know if it's really a liquid, but it prevents the alveoli from depressing and sticking together. So it keeps them kind of anti-sticky, so when the alveoli decompress, they can pop back up into their normal structure. And then we have our alveoli macrophages. The macrophages eat all of the dust and debris that actually make it down to this level. They keep it nice and clean, or they try to keep it nice and clean. And fun little fact, not so much fun, but with smokers, all of that sooty, old, black, yucky stuff from smoking that gets deep down into your lungs, the macrophages basically push them to the side of the alveoli way far to the corner, and they just continue to move all that black stuff to the corner, out of the way, so the inside surface of the alveoli is nice and clear. So when you see lungs of a smoker after autopsy in cadavers, they have this weird speckly looking black lung. That's because that is all that black soot that the macrophages continued to move to the corner of the alveoli. So those 3 cells create the shape, maintain the shape, and keep it clean. Why do we need to keep it clean and keep it that nice shape, that round, bulbous ball shape? Because the alveoli, around those sacs of the alveoli, you have all of your blood supply running around it. I don't have it in this visual, but when you see it in your textbooks, you'll have these veiny, I can't remember if they're veins or vessels, blood vessels, but either way you have your blood supply going around because the alveoli is a semi-permeable membrane and it is very thin. If you were to take a very, 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 very tiny scope down that could get all the way to this level and you were to look through the alveoli to where the blood supply is, you would be able to see the blood running through. It is that thin. And this allows for a gaseous exchange. When we inhale, that O2 will come in down to the level of the alveoli and there will be a gaseous exchange across the semi-permeable membrane of the alveoli into the bloodstream where the blood can pick up that O2 and move it through the body. This is also where we have CO2 being dropped off from the blood through the semi-permeable membrane into the alveoli for expiration, for exhaling. So these guys need to stay nice and clean because if there is dirt and debris, there's less surface area for that gaseous exchange, meaning less gas will be flowing through it, which will keep the blood oxygenated and also will be offboarding CO2 to be exhaled because you don't want too much CO2 in your bloodstream. And that is where we're going to be going next, to the gaseous exchange and why gases in the blood are so important and why breathing is so important. Okay, so now that we know what the lungs are made of and how there's a gaseous exchange, I know I didn't go too in depth on it, but a gaseous exchange happens. That is the main purpose of the lungs and the alveoli specifically. So once there is a gaseous exchange, either oxygen in or CO2 out, we need to look at why those levels in the blood is so important. So basically with the blood, it has to be at a specific pH. So if we have our pH scale, this being 14, which is basic or alkaline, and then 0 being acidic. The pH of the blood has to be between 7.35 and 7.45 pH. So it's kind of in that neutral sweet spot. It's not too acidic, it's not too basic or alkalinic, if that's the word. So it has to stay in the 7.35 to 7.45. There can be serious health risks and consequences if the blood stays either too basic or too acidic. And what's very interesting is there are receptors that essentially test the blood to see what that balance, what the pH is in the blood. And it sends signals to the brain that say, oh, we're too acidic, we need to adjust our breathing, or oh, we are too basic, we need to adjust our breathing. So then it sends signals to the lungs to influence how we're breathing to get our pH back into this sweet spot. So within the brain, I'll probably have to do another video specifically on the different parts of the brain so we know where some of these areas are that I'm talking about. But within the brain you have the medulla oblongata, and that is your pulmonary respiratory center. So the medulla oblongata gets the information from the chemoreceptors, which are testing the pH of the blood. When we move out of the sweet spot, that message is sent to the medulla oblongata saying we're too acidic, we're too basic, and it relays messages down to the lungs to influence our breathing to get us back into that sweet spot. Now, within the medulla oblongata, there are a couple of different locations in there that have specific duties as far as our breathing goes. So there is the DRG, which is the dorsal respiratory group, and the VRG, or the ventral respiratory group, and then we have the pons. Now the DRG, dorsal respiratory group, this part of the brain helps with smoothing out or evening out our breathing. So when you're sitting there breathing, when you're normally breathing, it's a nice slow inhale and then smoothly turns back down into an exhale. If the DRG wasn't working, our breathing would be very, very choppy, very that would be if the DRG isn't working, but we're nice and slow, in and out, nice and smooth transitions from inhale to exhale. The VRG, ventral respiratory group, this generates our respiratory rhythm. So this keeps our inhales and exhales essentially equal. We're inhaling for a couple seconds, exhaling for a couple seconds. When we're calmly in our normal breathing, we're going to stay at the same rate. It's not going to be a long exhale and a short inhale. The VRG keeps it even, so it's usually the same amount in, same amount out. The pons, which is my favorite part of the medulla oblongata and how it influenced the respiratory system, really, really cool. So the pons, or PRG, I think the PRG is a part of the pons, so a separate little section of the pons. Either way, PRG, or pontine respiratory group. This is what influences our breathing pattern. So you know how when you're scared, you take a quick inhale? That is the PRG. How cool is that? Or when you are hearing something nice or happy and you go, PRG! That's the PRG doing it. When you're not actively thinking about making those noises, it just naturally happens. That's the PRG doing its work, influencing how we inhale, exhale. How cool is that? And then also, have you ever noticed when you are just hanging out, doing whatever, and all of a sudden you do a sigh? You don't know why you sighed, and people are like, oh, what's wrong? And nothing's wrong, you just sighed for some reason. That is the PRG. But also, what is really cool is the pons and the medulla oblongata essentially getting messages saying our pH balance isn't quite balanced. We're a little too acidic, a little too basic. Off the top of my head, I can't remember which one. And we need to inhale, exhale, do that sigh. I guess that would be more of an inhale. So we need to inhale to bring in more oxygen because we have too much CO2 in our blood. So that sigh, that involuntary out of the blue sigh, is basically our body balancing our blood pH. So now what I do after I learned that is whenever I'm sitting around other people and I have an involuntary sigh, who knows why, nothing's going on, I'm not emotionally affected by anything. Someone asks, oh, what's wrong? I'm like, I'm just balancing my blood pH. Nothing special. So that's a really cool factoid that everyone should know, that our blood pH is very important, and our breathing is what maintains or regulates that blood pH. So how we breathe affects how much O2 or CO2 is in our blood, and it's our brain that is getting messages from the chemoreceptors to influence our breathing until we're back into that nice 7.35 to 7.45 pH level. How cool is that? It is so amazing. So talking about the blood pH and how the brain maintains, regulates, influences our breathing pattern, We can also look at different cardiac diseases, disorders, illnesses, etc. that might influence the amount of blood that is being circulated through the body. And we can see how those irregularities in heart rhythm, heart beats, that might affect our breathing because our body is telling us, or the receptors that are telling our brain, our blood pressure is too high, we have too much oxygen, we don't have enough CO2, or the blood pressure is so high, meaning blood is moving very, very quickly, that it isn't giving enough time for that oxygen to offload into other parts of our body, etc. Things like that. So we can see how our brain would regulate our breathing to try and even that out or help maintain that blood pH. But it's another thing to think of when you start looking at op reports or EKGs, etc., to look at what their heartbeat is and if there is information on their PO2 levels or that how much O2 is in their body, and see how that is affected by how their heart is beating. And then when you get into the sequencing of coding, when you have both a respiratory and a cardiac disorder, disease, etc. diagnosis, to figure out what is the root cause, to know which is your primary diagnosis, you can start to understand, is it the heart which is influencing the respiratory system, meaning the root cause of the diagnosis is the heart, that should come first, and then the respiratory is a side effect, or vice versa. So you can start to understand how they are connected or how they influence each other or react to each other. Very, very interesting to learn about that and to see how interconnected the respiratory system and the cardiac system are, specifically the circulatory system with the blood. But it does flow through the cardiac system, and how those two can be connected and go hand in hand with each other. It's really interesting. So this topic specifically with the blood pH I find very fascinating, and I love learning about it. So you can subscribe to this channel if you want more information on A&P topics, ICD-10-CM, ICD-10-PCS, or CPT, and you will get notifications on all the videos that I post, so you're always in the know. You can also post any comments you have below about this topic, or if there's anything else that you find interesting about the respiratory system and how it connects to the blood or the circulatory system. And if you have any ideas on respiratory disorders that you'd like me to cover in PCS or in ICD-10-CM, please put that in the comments so I can start working on that. And like this video if you liked this new setup of me sitting on the floor with my plexiglass. I'll see if I can do this more until I get a well-hung dry erase board / plexiglass, because I do like standing. We'll see what happens. And I will see y'all later. Bye!